Greetings from the CRA annual meeting. It's Friday, March 1st, and we have the privilege of having Dr. Timothy Kwok joining us today. Timothy's from the University of Toronto, and to start off, we'd maybe like to find out just a little bit about yourself before we dive into some of the work that you're presenting here this week.
Sure, yeah. Thanks for having me, everyone. My name is Timothy Kwok. Grew up just north of Toronto in Markham. Went to medical school at the University of Ottawa. I actually completed a CRA summer studentship during that time and really sparked my interest in rheumatology. And I brought that interest into the University of Toronto, where I'm currently completing an internal medicine residency.
Fantastic. And so some of that work that you're doing at the university, you're translating for rheumatologists and patients here this week.
But that's the goal, really, to really have the work, the research work, and really use it to change patient care.
So tell us your area of specialty or of interest.
Right, so I think my area of interest stems from patient encounters. Right now I'm working on a couple of projects at the University of Toronto, one of which is a project on osteoporosis and psoriatic arthritis with Dr. Daphne Gladman at the Toronto Western Hospital. I'm also working with a group at Sunnybrook Health Sciences Centre, namely with Dr. Mary Bell on a project on checkpoint inhibitor-induced rheumatic disease, as well as with Dr. Shirley Lake on some quality improvement projects.
Wow, that's an ambitious schedule or agenda. Excuse me. And those are some real leaders in the field that you're working with. So what an incredible opportunity. Two very distinct areas of research and study. So maybe why don't you take our audience through each of them and explain so that I can understand and our audience, I think, some fairly complicated topics, but that have a lot of potential impact for patients across the country.
Mm-hmm. So the first project I came across with was osteoporosis and the rheumatic diseases. And osteoporosis is basically, when your bones are more brittle than the normal population, and that could, increase the chances of having fractures from very low trauma. So I first came into contact working in an osteoporosis clinic at Markham Stouffville Hospital during my second and third year of medical school. And I kept seeing patients who, after a fall in the ice and in the winter storm, suffer a fracture. And after which, the quality of life really decreased. And I worked on a quality improvement project at the time at Markham Stouffville, and I really expanded that medical question to see how we can help patients prevent those catastrophic events. And Dr. Gladman and I and her research team are now looking into the prevalence as well as risk factors for osteoporosis in that population. As to my work in the checkpoint inhibitor in rheumatic diseases, I remember I came across a patient while I was on the inpatient rheumatology team at Sunnybrook. He had really, really devastating cancer, and immunotherapy was his only hope at the time. Unfortunately, after he started on treatment, he developed joint pain and signs and symptoms of a rheumatic disease. And this concept is very new. These therapies haven't been out for a while, and we're still learning about them. So when I came out with an impression and an approach to treat this patient, I wasn't looking at a lot of research evidence in the field. So this sparked my interest to study patients like him, so then we can provide better care of this phenomenon that we're still learning about.
Okay, so maybe let's look at those two areas and dive down a little deeper for our audience, for them to gain an appreciation for the work that you're doing. And it's very exciting. I mean, somebody who's fairly new still in the field relatively, certainly in the second example, doing some almost pioneering work. That's very, very exciting. So maybe for our audience, first of all, maybe let's just talk a little bit more about osteoporosis and its relation to arthritis. I guess particularly for our viewers who are living with osteoarthritis, what sort of implications are there for them?
Right. So certainly, bone health is very important to the general population, whether you have arthritis or not. In the literature, in the research studies, mainly they've studied patients with rheumatoid arthritis or other inflammatory arthritis that have an increased risk of osteoporosis. And where I come into play is I look in a disease such as psoriatic arthritis. Normally, there's no biomarkers in the blood, and it's not classically in the past thought of having an association with decreased bone health. So I'm trying to figure out if there is such a thing that exists, and if so, then we need to target these patients a little bit earlier on because we know that they're at higher risk of fractures.
So for that inflammatory arthritis patient, it's a good idea for them to be getting educated.
100%.
And being able to maybe have that conversation, not just with their rheumatologist, but with their family doctor as well.
Yeah, I would recommend, any patient with arthritis to chat with their family physician to discuss their bone health, and if they're indicated for any screening tests such as blood work or bone mineral density testing.
So a good place, obviously, for our audience to go to is our website, where we have a lot of disease information, not just on arthritis, but in areas like osteoporosis. A good place for them to start, and then to, I think, again, come up with some questions and be able to ask their healthcare provider about that. I guess moving on then to the checkpoint inhibitors, I think, again, a fairly complex subject area for our audience. Maybe you can describe it in a little more detail in terms that we can understand our audience, and again, maybe implications for them.
Right. So checkpoint inhibitors are a new class of medication. They were really put into the market starting roughly around 2013 and have been used since in a variety of settings, mainly cancer that has spread. And
what are they? How do they work?
Right, they work on several pathways, namely, it's something called a PD-1 pathway and the CTLA-4 pathway, and they're really, like the name says, checkpoints for cell replication, and they try to inhibit those through either of the two mechanisms, and try to revamp the immune system to help attack those cancer cells. So you can see the difficulty in that because autoimmune diseases like rheumatic diseases also rely on several of the similar pathways to act upon. So now that these drugs are in market for a few years now, we're seeing a lot of patients either who had rheumatic diseases prior to going on treatment or developing new rheumatic diseases while on therapy. And it creates an issue because there's not a lot of research evidence on this, and a lot of these diseases that they developed are not uniform. They can present as something like rheumatoid arthritis, something like lupus, something like vasculitis. So there's a lot of difficulty in, number one, categorizing them, and secondly, treating them. And there's a lot of exciting work going on in the CRA. There's a committee that has been developed since last year that's really looking into this, and that's where patient involvement comes into play because these diseases are so rare. We really rely upon our patients to tell us what we need in order to help them.
That's very exciting. If patients wanted to find out more, would the CRA website be a good place for them to go find some more information?
Yeah, I'm not sure if the CRA website right now has any patient education resources because this is a blossoming field.
Okay.
But I would ask them to stay tuned, and then I'll chat with my colleagues about it. Yeah.
As somebody fairly early on in their career, these opportunities to meet the leading researchers in Canada, many of whom are doing world-class research, is an incredible opportunity for you. Maybe you can give us some of your impressions over the past couple of days of possibly some presentations that you've been to that you found very interesting. The theme of the conference, Building Bridges, has anything stood out for you over the last couple of days?
I certainly had an amazing time the last couple of days. Like you said, many of our Canadian researchers are world-class and conducting cutting-edge research. Really what stood out to me is, several of the themes that are highlighted in this conference. Like you said, the main motif of this conference is building bridges. And I think, that can be interpreted in many ways. From my perspective, as a hopeful rheumatologist, I want to build bridges with my allied healthcare professionals, physiotherapists, occupational therapists, nursing staff, as well as other medical specialists. And like we said, in this new field of immunotherapy-related immune diseases, building bridges with oncologists. And lastly, another aspect is building bridges, and this is a new theme, re-emerging theme in rheumatology. How can we, remedy placing patients on immunosuppressants as well as preventing them from developing infections? So building bridges with family physicians to educate on vaccination regimens for our patients, I think that's very important, as well as our infectious disease colleagues. In the unlikely event that they developed infections, what can we do?
I think from a patient point of view, you're talking about that sort of integrated care model, and for patients to be aware that their healthcare team doesn't just consist of their doctor and their rheumatologist, that there are all sorts of other allied professionals who should be part of their team, and if they're not part of the team, that's something for them to talk to their doctors about. But for them to understand the roles of all of these different professionals in terms of delivering the best possible care for them. So what, again, very exciting, the work that you're doing. What, 5 years from now, where's Dr. Timothy going to be?
Well, hopefully I'll be involved in the field of rheumatology.
We hope so too.
In 5 years, I'll roughly finish my training.
Yes.
Right now, I'm interested in pursuing research as a possible career, so plan on perhaps pursuing some advanced degrees like a master's or a PhD in clinical epidemiology, or likewise like a field like that.
If people want to find out more information about the work that you're doing or that you're presenting here this week, where can they find that information?
So right now, I'm very young in my career. I don't have any established website or anything like that. But I believe the CRA is circulating some pamphlets about the presentations that have been going on during this conference, so I would defer to them.
Okay. I think before we end, we want to thank you for coming. Do you have any final words for our audience? People that are watching today or watching on our YouTube channel are obviously as curious as you are. It strikes me that that seems to be a theme that is happening right now in your career, that you have a very inquisitive mind and searching for answers. So are our patients. So maybe you can share maybe some final words with our patients.
Right. I think research wouldn't be possible, especially in a country like Canada, without patient participation. And I really encourage patients to chat with their rheumatologists or doctors. And the research questions that I come across are from patients. So I really appreciate their perspective and working with us to help them treat their rheumatic diseases.
Well, we certainly support you. And I think, speaking on behalf of certainly our membership at Arthritis Consumer Experts, really appreciate the work that you're doing.
Appreciate the time.
Thank you.
And we have one final question from the audience. Do you have any other research questions that you would be interested in exploring later on in your career?
Right. So I think right now, another research project that we have in mind is the role of musculoskeletal surgery in the psoriatic arthritis population. Classically, a lot of patients, before all of these therapies were developed catastrophic disease in their joints and required surgery. And where we're trying to look at, with the advent of biologics and other immunotherapies, if this has changed, and if so, what can we do to further prevent this joint destruction and prevent patients from going to the operating room. So that's a new area of research that I'm hoping to pursue in the upcoming year.
Great. We have no more questions. Thank you again for coming, and we'll look forward to the next interview.